Hi, everyone. We have another co-author spotlight here with us today, Dr. Anjali Nakra, who's in Delhi, India, our international co-author. Hi, Dr. Anjali. Can you introduce yourself?
Yeah. Hi, Shilpi. Yeah. So I'm Anjali Nakra and hello from India. I'm in Delhi, like Shilpi said. I am a primary care physician and a lifestyle medicine physician practicing in Delhi. And yeah, so I think I have two clinics. I try to separate the lifestyle practice because it takes such a long time compared to the primary care practice. Because while I love to give the advice, but I feel that implementation takes much longer, much longer effort from our part. So
Being so
yeah,
modest, you make so many changes and you're changing so many lives. I mean, I love your chapter. Okay, well, let's talk
thank
about
you.
how did you go from one practice to two with including a lifestyle medicine practice?
So growing up, I always dreamt of becoming a doctor, and it was so I was supported so much by my father, who really nourished my dream. Unfortunately, he passed away when I in my first year medical school, and so that is where I think my journey started then, because I was always I mean, earlier before that, I my goal was, okay, to heal people, to become a doctor and to heal people. But then I thought, no, it's more important to make people healthier and to be able to live longer. So, so that was an addition to my goal. And so I was always looking out for knowledge, for, some knowledge about lifestyle, about how we should eat, how we should, what kind of exercises are good for us. Stress, I mean, I believed would really be, was important. So all of these things, I just kept learning and learning. But one day I got to know the word lifestyle medicine, and this was, this was, I think, the first this was in a conference in Boston, the Institute of Lifestyle Medicine at Harvard. So yeah, so I reached Boston in 2013, attended the conference, learned from people, Brett Saties, Eddie Phillips, Wayne Dazinger, Herbert Benson. He was amazing. Uh, so it was like you know getting putting a name. Yeah, I wanted to do this, and now there is an evidence based medicine which I can practice and give it a name. Yeah, so that was um, a huge change for me. So I went back again in 2018, and it was so good to meet so many people there, who physicians. So it was a really valuable experience, connecting with so many people who believed in what I believed. And yes, it was a wonderful thing. And yeah, I became a member of ACLM since 2016. That has also helped me a lot. I became a member of Indian Society of Lifestyle Medicine, which is actually relatively a recent society. I was the honorary secretary and executive member till December 2022. For 2 years, I was in that role, and yes, that here I am still practicing and trying to change people's lives.
You're so modest. Okay, so I'm going to just pick out some things that you said. You know, losing a parent can obviously be very, very life-changing. So I'm
Yeah,
sure that affected you and your desires for medicine. But just
yeah,
learning about lifestyle and then just taking action, to fly across the world to America to attend a conference to learn about something new. I mean, not everyone
yeah,
would even think to do that, and you did because you're so genuinely interested in the field and the topic, and you've created your own
Yeah.
clinic about lifestyle medicine. You're
Yeah.
being so modest. And I love how lifestyle medicine, I'm glad you highlighted this. Lifestyle medicine is global. I mean, a lot of
Mhm.
what we've talked about with other authors is what's happening in America with the American College of Lifestyle Medicine. But it's in a lot of countries, and India is a huge one where there's such a heavy burden of these chronic diseases
Yeah.
now with the shift in diet and the Indian Society of Lifestyle Medicine and you taking leadership roles. I mean, it's amazing. Tell us a little bit more about your clinic, the name of the clinic, how someone could reach you if they were interested. Do they have to be in Delhi or can they be anywhere in India or anywhere in the world or Australia? Like, how can they work with you if they're interested?
Yeah. So my clinic is called Path to Health Clinic. So my lifestyle clinic is called Path to Health Clinic. And I chose the name after a lot of deliberation because I thought it's the path that everyone should tread. And yeah, I can be their partner on this path. So yeah, that's the story behind the name. And yeah, so anybody can reach out to me. I do on virtual consultations, and interestingly, you said Australia. I do have patients from Australia. So yeah, so it is. I mean, it's like in person, virtual, everything is possible. I think the world has shrunk, and I think that was a great learning from COVID pandemic.
Yes, COVID has definitely opened up different avenues that we
Yeah,
never thought possible, and it's
yeah,
allowed you to expand your reach, and I love that.
yeah.
So let's shift gears a little bit towards the book. I do want people to read your chapter and all about your life and how it's changed. But
Hmm.
why do you think a doctor or a healthcare professional should read this book, How Healers Heal?
See, I think it's the each chapter is a story by a physician, and it's so important uh, that we should all, everybody should read it. It's not just physicians, even non-physicians should read it, because it is about how physicians have, made the changes, and how they have faced and how they have faced adversity, and they have converted, embraced it, and they have, you know, they've kind of done something constructive out of it. They have helped themselves, and they have taken it upon themselves to help others. So it's a learning where everybody can, so physicians can learn, because a healthcare profession is not easy. The time, the sleep, the stress, the lack of time for exercising. I mean, well, not an excuse. We still have to exercise, but yeah, all these things matter. And how each one of us has shared our experience, so how we have overcome these obstacles, and how we have, managed and come out as winners.
You answered my next question, like why should a non-physician or non-healthcare person or patient read this book? So thank you for already answering that. Yeah, it's lifestyle medicine.
Yeah,
A theme that comes across when you read all the chapters is how it's almost a solution to burnout in healthcare as well, because it
yeah,
addresses so many parts of our
yeah.
overall health. What
Hmm.
takeaway could you tell someone who wants to make a change today, just being inspired by you and they're going to contact you, but what could they start
Mhm.
today with in terms of shifting their health, a small change today?
So making changes is, I mean, you said it, the small change. So it always begins with a small change, and behavior change is what is required. Making, developing new habits, and making small changes, which build up to very big. They kind of have big returns. And I think it's, you see, many of us would know what to do. It's not that we don't know that eating junk food is not good, sitting long time is not good for us, but it's difficult for us to negotiate, to make that change. And so behavior change is, I feel, the crux of the whole thing, and helping people to make those small changes, and maybe not overwhelming them, do so many things at a time. All these things matter, and it's important for us to support patients, and it's also important to help them find their motivation. Just telling someone to do something, well, how long will it last? Not very. So if they know that why they need to lose their weight, or why they need to be healthier, why they need to have their diabetes in control, all these things are the primary drivers for making a change for anyone.
That is perfect. Thank you. Motivating patients to find their why.
Yeah.
The why
Yeah.
for change. Okay, great.
Yeah.
Is there anything else you want to share? Of course, I'm going to put the links to your clinic and your videos.
Yeah.
Is there anything else you want to share before we wrap up?
I think it's, changing the lifestyle is difficult. It's not about, that we should be changing a whole lot of things. And it's not about, what is somebody else has done, we should be following them. It's about, again, personalized change. It's about what we can do, what fits in our life, and what we enjoy. I think that is very important. And it's also important that we keep our long-term goals in mind, and doing those small things right now build up to a very a very big change. And I always tell people, think of your best self and see where you're moving towards, how you're moving towards, what you need to do today to be one step forward to becoming your best self. And it's not only about the the physical aspect. Today we talk about the biopsychosocial model of health, where mental health, emotional health, what our genes, our habits, our eating habits, everything is important. And what is more important is working on our relationships and having our social connections. They're working on all those things. So so lifestyle medicine is so many pillars, and I think maybe in due course we will have more and more pillars, but working on each one of them is important. It's not that one pillar in isolation will give us will not make that big change that we look for.
Thank you so much. That was amazing. Everyone go read Dr. Anjali's chapter and go see her in her clinic if you're looking to make a change. This brilliant physician, and all of us are here to help you. Thank you so much, Dr. Anjali.
Thank you, Shilpi. Thank you so much for all the effort and putting it all together.
We're just hoping to help each person. Thank you.
Yeah, thank you so much.